Can auditory processing disorder be diagnosed in kids? Imagine a child who hears perfectly well but struggles to understand what's being said, especially when there's background noise or rapid speech. This can be confusing for parents and teachers alike. The good news is that, yes, auditory processing disorder can be diagnosed in children, but it's a detailed process that requires specialized testing and professional expertise. Auditory processing disorder, often called APD, is a condition where the brain has difficulty interpreting sounds, even though the ears are functioning normally. It's not a hearing loss in the traditional sense, but rather a problem with how the brain processes auditory information. Because of this, a child might hear sounds clearly but still have trouble understanding speech, especially in noisy environments or when listening to fast talkers. To diagnose APD, a child usually needs to be at least 6 or 7 years old. Younger children's brains are still developing, and testing results might not be reliable. The child must have normal hearing confirmed through standard hearing tests and possess age-appropriate speech and language skills. It's also important that their cognitive abilities are within the typical range, and they can pay attention and follow instructions for at least an hour. Children with conditions like autism spectrum disorder, Down syndrome, or significant developmental delays are often not tested for APD because these conditions can influence test results and make it harder to isolate APD as a separate issue. The diagnosis involves a team approach, with audiologists leading the testing. Other specialists such as psychologists, speech-language pathologists, and educators may be involved to rule out other causes of listening difficulties. Testing takes place in a sound-treated room to eliminate distractions. The child wears headphones and responds to different sounds and speech signals. These tests evaluate skills like understanding speech amid noise, distinguishing similar sounds, remembering sequences of sounds or words, and processing information separately presented to each ear. The results help identify which specific auditory skills are affected, guiding targeted support and intervention. Getting an accurate diagnosis is crucial because symptoms of APD can look like other issues such as attention problems or learning disabilities. Misdiagnosis can lead to ineffective or inappropriate interventions. Once diagnosed, strategies like classroom accommodations, speech and language therapy, and listening exercises can help improve the child's listening and communication skills. Collaboration between parents, teachers, and healthcare providers is essential to support the child's success. From a hearing health perspective, it's important to understand that APD is not a traditional hearing loss. The ears work fine, but the brain struggles to interpret sounds correctly. If a child is having trouble following directions, misunderstanding speech, or acting out in noisy settings, it's wise to seek a comprehensive hearing evaluation. If standard hearing tests are normal but listening difficulties persist, a referral to an audiologist for APD testing might be the next step. In summary, yes, auditory processing disorder can be diagnosed in children, but only by qualified professionals using specialized tests. The process involves ruling out other conditions and ensuring the child meets specific criteria. Early and accurate diagnosis allows for tailored support that can help children succeed in school and everyday life. If you notice your child having listening challenges, consult a healthcare professional or pediatrician who can guide you toward the right specialists for further evaluation. Remember, every child is unique, and personalized care makes all the difference.